We have been keeping a close watch on this surge of COVID cases over the past few weeks, so let's check in with Upstate Global Health Director Dr. Stephen Thomas. Dr. Thomas, good to see you again. Thanks for joining us.
Good to see you. Thanks for having me.
So let's start right here. Give us an update. Have we seen any changes in the transmission this past week? Where are we right now with this?
Yeah, so I think overall, just in general, the trend is a positive one, and so we're seeing decreases in the number of people that are coming to be evaluated for influenza-like illnesses, which COVID and RSV would fall into that bucket. A decrease in the percent of people that are actually testing positive, and the number of people that are in the hospital for COVID is actually going down locally, so that's good. Nationally, it depends on what part of the country that you're in, but there are certain parts that are experiencing a downturn, other parts that have kind of stayed at these elevated levels. So I would say overall it's a positive trend locally.
Yeah, we'd like to see it going down. This kind of has been the thing since COVID has been around. People like to compare COVID and the flu as if they're the same exact thing. How different is COVID from the flu?
Yeah, it's a good question. And this is a question that scientists ask and physicians ask and knowledgeable people ask. They should not be considered equivalent, other than they're both respiratory viruses. There are studies that have come out, both short-term and long-term studies, pretty big studies, in fact, that have shown that COVID has a higher death rate than influenza, that COVID has long-term negative impacts on multiple organ systems. Interestingly, the only organ system where they had not seen a difference is in the lungs. But I think that shows COVID's ability to infect multiple different organs. Longer length of stay in the hospital, readmissions to the hospital, everything seems to be worse with COVID. So I do not believe that people should be comparing the two in that way.
We have talked certainly a lot about vaccines, especially in the last couple of weeks, and I guess on the level of a lot of people are not getting them. What kind of information do we have indicating, and you can take them one at a time, the flu and the COVID vaccines actually work against the viruses they're supposed to?
Right, so you have to define what work means. So if you look at influenza, COVID or flu vaccines, season to season, it depends on how good the match is. We've had a pretty good match over the last 2 years. Match meaning the components of the vaccine versus what's circulating in the community. And so when you have a good match, the vaccine reduces your risk of getting flu by 40 to 60%. Getting flu meaning you have symptoms consistent with flu, which if you've ever spoken to anyone who's had the flu, it's a miserable experience. But the other thing that the flu vaccine does is it reduces the risk of side effects in your heart, so cardiac risk factors. It reduces the negative impact that flu can have on chronic conditions like COPD and people with diabetes. So it does a lot more. It delivers a lot more value and benefit than just preventing influenza. And in terms of COVID, and you got to parse out who we're talking about. We're talking about these high-risk people, so people over 60 or people of any age with significant medical problems. It reduces your risk, especially this XBB 1.5 vaccine, reduces your risk anywhere from 60 to 70% of dying, ending up in the ICU, or ending up in the hospital. And I think that that's pretty good. And what we've talked a little bit about in the past, there's also increasing data. I mean, now we've got over a dozen studies that have shown that getting vaccinated against COVID reduces your risk of developing long COVID. And of course, that applies to younger people and people that we would not typically put in that at-risk category for flu. So I think there's really no question that as time goes by, the benefit that is delivered by these vaccines outweighs the known risks of the vaccines.
What's your personal advice for people about masking?
Yeah, so in the community, so if you are someone who is at risk, over 60 or of any age with significant medical problems, and you are going into a place that there's going to be lots of people, I would seriously consider wearing a mask in that environment. It is best when everybody's wearing a mask. That's obviously not going to happen these days, but it is an imperfect but yet another layer risk mitigation along with vaccination and washing hands and being smart about where you go and what you do, that can help protect you against getting infected. So again, for those high-risk people in those situations, I endorse having a mask as a potential tool in your toolbox.
Dr. Thomas, we appreciate you as always. Thank you very much. We'll see you again soon.
Thanks a lot. See you soon.